Welcome back to Morning Break and this week's Monday Motivations, brought to you by Gates Brain Health. We have Dr. Randall Gates himself joining us now. He is a board-certified chiropractic neurologist and chiropractic physician. Today we're talking about how your thyroid can be related to several different conditions that you may be experiencing. We were chatting a little bit off camera that, you know, thyroid conditions, it kind of seems like that catch-all kind of diagnosis.
Especially at this point.
Is it really as severe or as common as we are hearing about?
Yeah, so I would say this condition called autoimmune thyroid disease or Hashimoto's is as common as you're hearing about. Interestingly, most individuals, when they have their thyroid checked with their doctor, they're getting a thyroid hormone check, but they're not typically checked for this immunological condition to the thyroid. And we're finding this immunological condition irrespective of your thyroid hormones. So thyroid hormones can be normal, but there can be this immune condition to the thyroid that affects many different parts of the body. And that's what I think is really important.
And you're telling me too that the testing for thyroid is just not as comprehensive as you would like to see.
Right, so there's one or two main markers that are typically done when an individual sees their primary care practitioner or another doctor. And there are many other tests that can be done to tell if they have this autoimmune thyroid condition.
Okay, and it can lead to things like vertigo disorders, brain fog. Tell me a little bit about this.
I work, as you know, with a lot of patients who have vertigo, balance issues, and it's actually a central part of my workup because there's a lot of data that many of these different inner ear conditions, you name it, so Meniere's disease, benign paroxysmal positional vertigo, even vestibular hypofunction can be affected by Hashimoto's or this autoimmune thyroid disease response. Okay,
so how do I know that I need to ask my doctor for a more comprehensive test?
So you just ask them, I want to be tested for Hashimoto's. I want the thyroid antibodies run. And I think that's really important for everybody who's watching, for them to have that information in their arsenal, because oftentimes they'll ask their doctor to check their thyroid, but they don't know what test to ask for. So ask for thyroid antibodies to be run.
Now, if I just go into my doctor,
if you want that.
I was going to say, if I just go into my doctor and everything seems perfectly healthy, and I say, I just want this test done, will they do that, or do I need to be presenting some sort of symptoms?
You might have to present some sort of symptoms. You might have to have that dialogue with them, kind of as we're going to talk about other conditions that are associated with this as well. But it is important. There's a lot of research to support this.
Yeah, there's brain fog as well, and the thyroid and neuropathy. Tell me about that.
Neuropathy, yeah. So if somebody suffers with brain fog, thyroid antibodies can be an important part of that workup. There actually have been great studies done where they look at individuals who have hypothyroidism, who are taking thyroid medication. They find that those with the thyroid antibodies oftentimes have brain fog, and their quality of life is impaired. So there's that. And then relative to neuropathy, so carpal tunnel is really important for our moms out there and others who are doing repetitive types of activities on a daily basis. And so if it's on both sides, then a thyroid issue can be really important to look at.
Interesting. And what's the link there between?
The link there is that it seems to be that this autoimmune thyroid component, or if your thyroid is low, because thyroid hormone affects every cell in your body. So every cell in your body has a thyroid hormone receptor. So if your thyroid hormone is low, neuron function is going to be low. That can lead to swelling as well in the carpal tunnel, which is a tight anatomical space. And then that can lead to carpal tunnel syndrome.
And unfortunately, as seems to be the case for so many diseases, this affects a lot of women.
It has a strong female preponderance, as we term it, yes. So it affects a lot of women.
Lucky us.
Right. So that's why it's important, I think, that people know about this.
And absolutely, and where can they go if they're thinking this, they're listening to it and saying, okay, he mentioned that, I can't remember exactly what he said. Where can they go for more information?
They can go to my website, gatesbrainhealth.com. I have a lot on there, or my YouTube channel. Just go on YouTube, search Gates Brain Health, Thyroid. I have a lot of videos on it.
All right, very interesting. All right, sir, thank you so much for being here. I always feel like I learned so much when I talk to you, so I really appreciate it.
Thank you, Rebecca.
All right, stay with us. We'll be right back here on Morning.